All right, everyone, it looks like we're going to go ahead. I would like to welcome you to the session on the global perspective. My name is Darius Bagley. I am 57 years old, a little tired of being an adult all the time, and I think one of the most inspiring things we can take away from the last session is it would help us all if we thought more like those young people, and I think it will really lubricate the whole innovation concept. I'm a pediatric surgeon and pediatric urologist and an associate surgeon-in-chief at the Hospital for Sick Children. We're going to move around very quickly and get some introductions. We have 7 people we'd love to hear from today, and then Suresh will lead us off with the first question. So,
all right, hello everyone. My name is Jussi Määttä. I'm from Finland. I'm an engineer and I'm an entrepreneur. I do business in Finland and in the US, so I kind of understand both perspectives on this. I think that I'm the only one who's not on medical side in this panel.
My name is Elizabeth Steife. I'm a nurse, and I'm the director of the HIV and Orphan Care Initiatives at Saddleback Church.
My name is Matthew Cook. I'm the executive vice president for strategy and business development at the Children's Hospital of Philadelphia, and the international programs at our institution report up to me.
I am Jorge Fernandez from Barcelona, Barcelona Children's Hospital. I'm the Director of eHealth in the Innovation Department.
My name is Alberto Tozzi. I'm from Rome, Italy. I'm working in a very large hospital. It's about 800 beds. It's one of the largest in Europe. I work as a researcher responsible for an area of different disciplines. I'm also responsible for a telemedicine unit, and my background is epidemiology, infectious diseases, and preventive medicine.
I'm Jennifer Dower. I am a Senior Vice President for Strategy and Growth at Cincinnati Children's, and like Matt, the international part of the organization reports up to me. Prior to joining the hospital, I spent 26 years at Procter & Gamble. 5 of those were outside of the United States, leading global businesses. And so it's interesting to come into this industry and think about what the possibilities, the opportunities are, and thinking about the kids that were just up here. How do you really center everything we're doing with the consumer in mind, or in our case, the patient and the families?
Hello, my name is Thomas Ngwiri. I'm from Kenya. I work at the Gertrude's Children's Hospital. I'm a pediatrician, endocrinologist background, but I also head clinical services at the unit, so I'm the one responsible for enforcing using the EMR. I'm here because my hospital is a member of the Children's Hospital Association. Since we are the only children's hospital in Kenya, we can only benchmark with institutions around the world.
Hi, I'm Suresh. I'm a pediatric emergency physician and the CIO and CMIO at Children's Hospital of Pittsburgh. Thanks to Anthony, Darius, and the panelists for this opportunity. Though this is great, I think it's a little unfair for us to follow Dr. Patrick and the wonderful kids who went before us. Before I start off with the first question, and we have 3 questions for our panelists, a little bit about background about myself. I went to medical school in India in the late 80s and did my pediatric residency 91 to 93. At the Institute of Child Health in Madras, India, one of the large hospitals in the country, probably the largest children's hospital in South Asia, 550 beds. Just to give you an example how innovation is looked upon in the developing world. Most of us at that point, we innovated without knowing what innovation is. It wasn't optional, and in most days, it was about survival. And I was trained in a big city, and the hospital did not have a CT scanner at that time on the premises. And again, we are talking 25 years ago. The city had 2 or 3 CT scanners. I don't think we had any MRIs at all. And different hospitals in the city, pediatric and adult, had to take turns, and there was a schedule posted as to when they could electively send patients for a CAT scan. So I think my hospital had 2 days a week where we could send patients. So if we had 2 patients, similar patients, pediatric patients who needed CAT scan, and if they just happened to come on the wrong day of the week, somebody got it the next day, and patient B got it 3 or 4 days later. What that forced us to do as trainees is to become really good clinicians. And we didn't think about it that way. We just had to. I was fortunate to be a part of a team which saved hundreds of thousands of lives across years just because key resources were taken away from us, and that's how we innovated. With that little background, I would like to turn it over to the panel with the question, how do you define innovation in your country, area, space, field of expertise, and what are the key drivers? Realizing suddenly how many countries are represented here. We have Kenya, we have US, Italy, Spain, and Finland. Great.
Thank you. When I think of the definition of innovation in my country, I think of it in two ways. For the elite, which might include the people in this room, people in academia, people in the hospital, they are doctors, I think we tend to equate innovation to research. So we think about this research question, we think about going through an ERB, and that's what we think is innovation. But for the regular guy on the street, which is a more informal environment, I think they think of innovation as solutions to everyday problems. So you're faced with a problem, you think of how to solve it, without realizing you're actually innovating. So if you look maybe at any world ranking, you'll find very few third world countries scoring well on innovation. But actually the people every day are innovating things which are making life livable in the countries, but yet they may not have the means to publish, to scale up, to commercialize, and so they don't appear on any index as innovators. But I think that there are many innovators on the streets.
Just building upon what you were saying, I think that for me, innovation is about finding solutions to either problems or opportunities that create value. And I think that often there is a judgment that is ascribed to what value is. I think if you go back to the children, the patients that were sitting on the stage earlier and the challenges that we face, the question is not what do we believe value is, it's what do they believe value is. And I think if we can continue to bear that in mind and be very centered on what matters to them, whoever they are, then I think that there are tremendous opportunities. And I think the idea of, is it on the ground or is it elite? It really is that full continuum that's critically important. For me and my experiences, both at the hospital and before, part of the question is who needs what, who needs it now, and how do we think about bringing it forward? And bearing in mind how complex or how simple, how expensive or inexpensive can that solution really be? Some of the best innovations that I've ever seen have actually come out of the developing world, out of the emerging markets, because limitations and constraints creates possibilities. Oftentimes, I think what I've observed is resources and riches create slowness in our innovation and our ability to really see what the breakthrough's all about. So I think those are some of the parameters and some of the attributes.
Perfect.
I don't think that there's a local definition of innovation, and I think that innovation is universal. As Thomas said, it's solutions. I would say that we can add some attributes to this word, which is solutions that can be shared with others. That's very important. And solutions that are affordable and sustainable. That's possibly one of the main thing that is difficult to achieve. I will get back also to the concept of confusion between research and innovation, because this is very frequent, and we are always confusing research with innovation. This causes a lot of problems, because we're pretty good in writing papers. We do a lot of publications, a lot of ideas, and few innovations, because actually we're not able to translate every idea into something that is usable for somebody else. And this is dealing with methods, I think. So as a pediatrician, I'm not very familiar to the methods that are used in the industry for innovating, what is the spirit of entrepreneurship, and which kind of tests should be made for translating an idea into an innovation. There's another constraint that I would say, which is the very old discussion that every innovation should be tested as we do with drugs, for example, with clinical trials, which I don't think it's a case, because innovation, it's something different. And this is something that is limiting our efforts, at least in Europe and in my country so far.
Jorge?
I fully agree with my colleague Alberto. And yeah, I wonder why do you ask this question to us? Because we are from outside of the US. I mean, like innovation, has no local attributes, no local definition. So the way we see it is, it's something different from improvement. Okay, that's what the type of things you do when improvement is not enough. It's no longer enough. Okay, and because we've had problems in healthcare ever since the beginning. It's one of these systems that is intrinsically full of problems, right? We are 200 countries in the world, and not even one of them is happy with their healthcare system, okay? So, it's full of problems, okay? So to us, the two attributes that innovation has, number one, it is starts with problems that you cannot solve by continuous improvement, number one, okay? But number two, adoption, okay? So, it doesn't have to be something only new. You have to move forward from a pilot phase, okay? So we consider innovation something that is above 50% of adoption in whatever the field it is, okay? And apart from that, is something that that is innovation when I always say that innovation has the no embedded inside, because innovation, right? So it has to start always with somebody saying, no, this is impossible, you cannot do. At our hospital, we started our innovation department in 2007. We have more than 40 projects running, and I can tell you that one of them started with somebody saying, yeah, this could work. All of them started with somebody, usually the big guy, saying, no, this cannot work. Okay.
Awesome. Matt?
We talked about this yesterday about our hospital in Philadelphia. We had to really challenge ourselves to think about innovation very differently than we do today, and I would echo the comments from the panel. I think we're an organization that historically thought about it as equating it with research and developing novel clinical programs. And I think really where we've ended up as an organization is thinking about it as everyday breakthroughs. And a breakthrough may be advanced clinical care, but it may be something as simple as a different way of interacting with the patient. And so we've had to broaden and democratize the notion of innovation and make it much more approachable for all of our employees, our staff, our patients and families, and understand that innovation may come from any one of those sources, and that our strength as an organization is really facilitating those novel ideas that come through, whatever they may be, and bringing them to fruition, or finding a way to support them to bringing them to fruition.
Well said. And now from a non-clinical perspective, Elizabeth?
Or clinical, because I am a nurse, and that's part of the innovation. My favorite definition of innovation is passion applied to pain. Working in an organization that collaborates with healthcare, and I happen to be a part of the Gates Initiative, Global Health, and our own church, actually very close to here, has sent ordinary people, 20,000 of them, to every country in the world to work on global health. That's innovation. And so the standards of innovation as it relates to global health is the idea that we are learning from each other. And we really have three characteristics. It needs to be sustainable. What can go on when we don't? It needs to be scalable. What is a solution that cannot just be used in one application but can go globally? And it is very innovative to think of global health and the learnings that we get both ways. And then it has to be reproducible. So whatever I'm inventing, it cannot be used by others. And the idea that it's innovative, that it is a small world after all, is a wonderful definition of innovation.
Great. Lucy?
All right, thanks. From my perspective as an entrepreneur, I'd say that innovation is a product or a service that has been commercialized somehow. So, and as you told, just like innovation is scalable. That's what I think as well. We Finns in Finland, we are known as from our engineering skills, and many people in Finland, they do great products or services, or at least they have developed some mobile applications or software. But Finns are not that good in commercializing new products or in innovations, and there are few challenges what they face there. There are some funds in Finland who are like early stage funders for companies, for example, Finnish government innovation fund, and they don't fund any commercialization activities, they just fund product developments. And that leads in the situation that companies who have a great idea, they just stay 1 or 2 years inside their own room and develop something, and then they get out and start asking from people that, could you use that in somewhere? And in hospitals, as many of you told, the answer is first phase, no. You have to start discussing with hospitals and with professionals and listening to them and trying to understand what are the problems, what you want to solve there.
Great, Darius.
Thank you. I think that we're hearing a number of different and yet related definitions of what innovation is, but I know one thing we've grappled with in our organization is just defining so that people are all understanding on a level playing field what innovation is, and I still don't think we've come to a consensus, and yet it's happening, which is great. We're hearing about innovation dovetailing with research, and yet there are differences, but what are they really? And that sort of leads into another question regarding framework or boundaries or context or regulatory bodies, if you want to call it that, or the rules, to keep it simple. How or could the panelists comment on what the differences globally, outside of the Western world and the European world, for example, the regulatory frameworks might differ from what we're used to here in North America. There may be, we talked about this with Thomas a little bit yesterday, there may be a different bar out there. Is that right? Is that wrong? Is it a reality? Could the panelists comment on this?
Anyone? Matt?
I think it's a fascinating question, because I think from the perspective, and I think Jennifer would probably share this, being a fellow US-based institution, it's often a gray zone in the developing world, and we don't know exactly how to effectively move forward in that gray zone. And so we take chances, and we hope that things work out for the best, and we try and make sure that we have developed a proper network in whatever country we may be operating or doing business or supporting clinical care in, hoping that we do not make missteps. But I think this is one of the challenges with innovation as you move from the developed world into the less developed world, is what are the rules? And the rules are typically not defined. And so that's the opportunity that we have as organizations to partner with local authorities and try and develop the rules, but every country works differently. And so those rules are may be developed quickly or may take years to do that. And so at the end of the day, it becomes about flexibility and your appetite for risk.
Innovation involves relationship. So in any country you're working anywhere, learning from each other, having spent about 200 days just last year in the country of Rwanda, our neighbors here and friends, you'll find a great deal of high structure. As we first started working in the country a decade ago in HIV, the structure against privacy for patient data and probably the value of I must capture that data, and I don't want any NGOs or other healthcare providers thinking they're doing good by testing people, but the country can't grab the data. And we found their regulations to be even higher. But this last year, when they wanted to vaccinate 3 million children in a weekend, the limitations and the regulations were different than what we might experience in the US, and it got done because they accessed some other kinds of innovative care delivery solutions. So I don't think we can say the regulations are higher or lower, but every innovation has a barrier, no matter where you are, and we can't use the barriers as an excuse for not innovating, and the barriers are broken through relationship. And when you're working particularly to either learn from the global world or to work in the global world, when you honor that the people that are nearest to the people you're trying to serve have their best interest in mind more than you do, and you honor the indigenous innovator, then you can begin to innovate together in spite of regulations or creating ethics of regulations.
Well said. Husi, you want to add something?
Yes, I can continue. I would like to extend this question from regulation also to other perspectives. What's the difference between US and other countries? And for example, from European perspective, difference between Europe and USA is that in USA you have same language or same languages all around, English, Spanish. And in Europe we have 20, 30 languages which are spoken all over Europe. So when you start developing or innovating, you usually start from your own country, which is small. You might face the situation that you don't find enough innovative partners in your own country, and you have to go abroad where they don't speak the same language with you. So that's one perspective what it comes to not regulation but barriers at least. And also from Finland I can say that the business model in healthcare is totally different compared to US, where you have private healthcare mostly. We have mostly public healthcare, and public hospitals are dominating players in the market. And when we are dealing with public hospitals, personnel there, they are not that innovative always, and they are only paid to do their job and actually take care of the people. And when you want to innovate them, then you face another challenge, and you have to find the right people to affect and start doing things. Things are going forward and things are changing now, but there are challenges on both sides.
Jorge?
Comparing the US and Europe, which is the countries that I more or less know, I would like to make a differentiation between, let's say, management innovation and product innovation, okay? Because I think all that we're talking here is product innovation, which I fully agree more or less, and then I'd like to add a little bit. In terms of management innovation, I think the barriers are not the countries, but the people who are on top of the organizations. Okay, that would be my take. And in terms of product innovation, no matter where I go in the world, the people that are there, they think that they are suffering from the worst barriers. Okay, so if I attend a conference in the US, they tell me there is no money, the FDA is terrible, and I don't know, whatever it is, right? But if I go to a conference in Europe, they say the same, right? There is no money, Europe is terrible because we have 20 languages, and so I think we all have our own excuses, and as you were saying, we need to break these barriers. It's difficult because it's always starting with a no, but that's what we have to do.
One point I would like to make why I still feel innovation, it's a different paradigm in certain developing countries. To bring the example of a paper which was published recently, about 6 months ago, in Critical Care Medicine. So this is large hospital in India, and they published a series of 200 plus patients with CNS infections who had burr holes placed by pediatric intensivists. This will not happen in the US. The mortality rate for those 200 odd patients was 30%. Again, the definition of safety, the bar of what standard of care and quality of care is, still happens to be different. The argument to continue that practice in developing countries would be, if you did not place that borehole, the mortality rate will be close to 100%. We cannot take the sepsis guidelines, the CNS infection guidelines, which are available to all of us here, and expect most of the developed world to follow that, even if it is 10, 15 years later. And that's one reason why I feel certain developed countries innovate at a faster pace, and the innovations may only benefit the patients in those countries, but we are still talking thousands and millions of kids. Any comment on that?
Yeah, I think there's a familiar ring to what you said. And I think the difference is in the approach. If we are looking at innovation as research, or from a research angle, then you'll find that the regulations in a country like Kenya probably make you feel like innovation is illegal. Because one of the things they ask you when you want to do anything new is, where else has this worked? And if you're going to use a cent of public funds, you must demonstrate that this has worked in the United States, in the United Kingdom. We also look quite a bit to India as a third world comparison. So if it hasn't worked there, why do you want to risk public resources on something that you cannot demonstrate success? But at the same time, if you're coming in to solve a problem, especially if it's local, and for example, if you're looking at cascading skills, which were initially in the hands of doctors and now you want nurses to practice them, treating sick children, critically ill children in an institution that does not have a doctor, then straight away you don't encounter any barrier because this was not really seen as research. It's just that the nurse had to make a decision and treat. So if you're analyzing the success of that a few years later, you find that the implementation was very simple, but it's because you looked at it from the perspective of solving a problem. So I think there's a big difference in which door you used to enter. If you use the wrong one as a research, then you'll be 3 years trying to solve the bureaucracy.
Yeah, well put. What I'm taking away from this is to look at the innovation index a little differently from now on and not take it at face value, I guess. Darius?
Right. I think Anthony's asked us to wrap up. But one of the things that kind of comes to mind when we think about the rest of the globe, and particularly areas of the world that are still developing, is that innovation is driven there out of specific need and lack of resource that we enjoy in the developed world. So one thought we might leave you with as an innovation experiment in your institutions would be to think about how you might inspire innovation by taking away a specific resource you enjoy now and see what kind of solutions you then come up with, because that's what the rest of the developing world is doing. So that might be an interesting experiment or way to think about innovation even here. Thanks.
Well, on that note, since we had an excellent problem having an outstanding keynote that went beyond a lot of time, we're going to give all of you a 15-20 minute break. We'll reconvene at 10:45. Thank you.